Hello, this video is going to review weight-based drug calculations. Okay, here's our first question. Is the ordered dose safe? Okay, is the ordered dose safe? What do I need to do? I need to look at my doctor's order and find out how much medication the patient is getting. And then I need to know the safe range, the high and the low ends, and make sure that how much medication my patient is getting is falling within that safe range. Okay, so in this case, my doctor's order is 700 milligrams 3 times a day. Okay, and my safe range is 500 milligrams to 3 grams per day divided in 3 to 4 doses. Okay, so there's a lot of possible confusion here. So first thing I'm going to do is I'm going to find out how much medication per day my patient is getting. Med per day equals how much med per dose times how many doses per day. And in this case, I'm getting right here 700 milligrams. I have 700 milligrams in one dose. How many doses per day? I have TID is 3 doses. 700 times 3 doses a day. 700 times 3 is 2100. My patient is getting 2100 milligrams per day. That's what the doctor's ordering. You see that? 700 milligrams 3 times a day. 700 times 3, my patient's getting 2100 milligrams per day. Now I'm going to find out how much, and it says 500 milligrams to 3 grams per day in 3 to 4 doses. Now, my per day is right here, 500 milligrams to 3 grams per day. This falls in that safe range. Yes, my dose is safe. However, a lot of students get really hung up on this 3 to 4 doses. And what I want you to think about is this is what the patient's getting per day. That's how much they're getting per day. That's the safe range per day, but we're going to take that per day and divide it in 3 to 4 doses. And you see we are taking our 2100 milligrams per day and dividing it in 3 doses. So you see it falls within the range and the dose is safe. We are happy we're giving our patient a safe dose for that medicine. Okay? All right, let's try another one. Okay. So now, how many milliliters will you administer? How many mils would you administer? So how many mils would I administer? I need my doctor's order and I need my label because now I'm doing a D over H times V calculation. But in this case, my doctor's order is written a little bit differently than a standard order. This doctor's order is written by an amount per weight. Okay, so in this case, it's 15 milligrams per kilogram per dose. And I need to know my patient's weight. And right now my patient's weight is in pounds. And we know that if we take 65 and divide that by 2.2, 65 divided by 2.2 to get the patient's weight in kilos is going to be, let's see, it says 29.545, okay? So I have to round this to the nearest tenth. This is my tenth number. In order to round to the tenth, I look at this number, which is 4 or less, okay? So I am not changing this. My patient's weight is 29.5 kilograms. That's my patient's weight. So now I'm going to go up to here. And it's 15 milligrams per kilogram per dose. And I'm going to take 15 milligrams times 29.5 kilograms. 29.5 times 15 equals 442.5 milligrams per dose. That is what my doctor's order is. I just calculated it out, 442.5. So now in my D over H times V, my D is 442.5, and I'm keeping that 0.5, okay? 442.5, and I need to look at my drug label. Divided by 160 milligrams in 5 milliliters. So I'm going to calculate that out, 442.5 divided by 160 times 5 milliliters. And that's going to equal another crazy number, 13.828. Okay, and I want to round to the nearest tenth. So I'm going to look at this number here, this 2. Because it's 4 or less, my answer is 13.8 milliliters. Okay, I do not go up, I stay here. 13.8 milliliters per dose. Okay, Next question. How many kilos does the patient weigh? So this is a perfect example of why you should read the end of the question first, because many of you are going to go out there and maybe you paused the video when I pulled this label up and you already started calculating how many milliliters you'd be giving for IV dose, and you'd be reading labels and wasting a whole bunch of time. All we need to know is how many kilos did the patient weigh. So we're 176 pounds divided by 2.2. 176 divided by 2.2 equals 80. This patient weighs 80 kilograms. That's my final answer. Okay, read the end of the question first. Okay, next question. How many milligrams will you administer? All right, here we go. How many milligrams will you administer? I need to look at my doctor's order. I don't care about my label because it's just milligrams will you administer. And again, my order here is 20 milligrams per kilogram per dose, and my patient is 72 pounds. So first thing I'm going to do is 72 divided by 2.2, because I need to find out my patient's weight. So 72 divided by 2.2 equals 32.727. I want to round to the nearest tenth, so I'm going to look at this number right here. It's 4 or less, so my patient's weight is 32.7 kilograms. That's what I'm going to use here. All right, so I'm going to look back here at my order. I have to multiply 20 milligrams times 32.7 kilograms for one dose. So 32.7 times 20 equals 654. I'm going to be giving 654 milligrams per dose. Okay, moving along. Weight of the patient in kilos. Again, don't need to calculate all this out. All I care about this is that 124 divided by 2.2 equals, what am I got here? I got 56.3636. So I want to round to the 10th. I'm going to look one number past the 10th. So this is the number I find out what I'm going to do, and it's 5 or greater. So I'm going to go up. It's going to be 56.4. So my patient's weight is 56.4 kilograms. Okay, moving along. Milligrams per dose will you administer? Okay, I don't care about my label for this one. I care about my order and my patient information. So my order here is 10 milligrams per kilogram. My patient's weight is in pounds. Be careful, your patient's weight might sometimes be given to you in kilos, and you don't need to change that. But in this case, I need to take 176 pounds and divide that by 2.2. 176 divided by 2.2 to get my patient's weight equals 80 kilograms. That's how much my patient weighs. And then up here, I'm going to go back to the order. I want to multiply 10 milligrams times every kilogram. So it's 10 times 80. 80 times 10 is 800 milligrams per dose. Okay, keep going. How many milligrams per day will the patient receive? Okay, milligrams per day, not per dose. And then thankfully, look at this. This is written milligrams per kilo per day. So I know that this is going to, when I multiply the weight by 25, I'm going to get that per day range. So I do need to take my 124 pounds and divide it by 2.2 in order to get my patient's weight in kilos. And that's going to equal 56.3636. And again, to round to the nearest tenth, I'm going to look at the 100th number, that's 6. And I'm going to round this to 56.4 kilograms. That's my patient's weight, okay? So I'm going to look up at this order here. Oh, I shouldn't have written it there, though. I'm going to look up at that order there, and I'm going to do 25 milligrams times 56.4 kilograms, and that's how much I'm going to be getting per day. So 25 times 56.4 equals 1410 milligrams per day. And I'm looking at this label. It's 25 milligrams per kilo per day. Okay, you got to read it very carefully. All your information is there. What is the safe dose range per day? Okay, this is one of those problems where I don't need to do any math at all. My safe dose range per day is right here. 500 milligrams to 2,000 milligrams. That's my safe range per day. I don't care it's 3 to 4 doses. I just know that I would take that 2,000 milligrams and divide it by 3 or 4 per dose. But that's asking me per day. So this is my final answer. Okay, what is the weight in kilos? Again, I don't care about any of this. All I'm going to do is take my 53 pounds, divide it by 2.2. 53 divided by 2.2 equals, let's see, we got 24.090. And again, I'm going to look at this number here, one number past my 10, and I'm going to round up to 24.1. 24.1 kilograms is my final answer. Okay, last one. How many milliliters per dose? Okay, so I'm going to need this. I'm going to need that. Okay, milliliters per dose. First thing I got to do is I got to figure out, I'm going to do a D over H times V calculation here, and I need to figure out my doctor's order. It's 10 milligrams per kilogram. So first thing I need to do is put my weight in kilos. 176 divided by 2.2. 176 divided by 2.2 is 80 kilograms. 80 kilograms. Okay, so now I'm going to look at this, and I'm going to know that it's 10 milligrams for every kilogram. So 10 times 80 equals 800 milligrams. That's going to be my dose here. Okay, now I need to D over H times V this. I know that my D is 800 milligrams. What do I have? I need to go in here and look. And it's IM or IV use. And now I need to know, I need to look at these concentrations. And there's two. There's one for IM and one for IV. So I am going to look for the IV concentration. And let's see, IV use, here it is. Add 10 mLs. Each ml contains 100 milligrams. So I'm going to do 100 milligrams times 1 ml. Do you see that? I had to look for the IV use concentration here and use that in my calculations. So I'm going to do 800 milligrams divided by 100 equals 8 times 1. So I'm going to give 8 milliliters per dose. Okay. I hope you found this video to be helpful. Please go back, watch it again, or send me a message if you have questions. I'm always happy to do math with you. I hope you have a great day and enjoyed this video. Bye-bye.